I went to work, it was a normal day, I was very busy. I noticed that something was happening to my brain in that it was like blood pouring out of my brain. I couldn't think straight. I was losing control of my body. So I stood there by my desk and I fell backwards. It wasn't plainly obvious what had happened to me. Luckily, all my staff were really decisive and they called an ambulance. And from that moment onwards, I was really scared because the shock and impact of your brain not working is really hard to describe. And I remember being rushed into King's Hospital, and with the benefit of hindsight, I learned that Tom Clark made a very decisive decision. Once the stroke had been diagnosed as a thrombosis blockage to my brain, he made a decision to operate through the artery through my groin and release the blockage, which, with hindsight, saved my life. I'm obviously a survivor of your brilliant skills within the department, but what do you see as being the key challenges now in terms of your stroke research and the priorities in terms of how you can treat people quicker and be more effective?
The first challenge, of course, would be, can we prevent stroke altogether?
Yes.
Now, there are lots that we already know in terms of blood pressure and diabetes and smoking.
Yes.
And a part of the research is to find methods on how do you get this message across and how do you get people to comply with that.
Yes.
That is one of our biggest challenges, and we've got a whole department devoted to that. This next question is, how do you repair this brain? Yes. Now, that is very fundamental. That's the next frontier.
Yes.
And what we're doing is we're doing lots of research, mostly in the laboratories and neurosciences, looking at things like stem cells, looking at things like new cells in the brain, because the brain does produce cells. Now that's again something very new. Not only does the brain produce new cells, but when you have injury like stroke, for example, that production actually increases. So in a way, we know from our experiments, both in animals and in humans, that the brain is trying to heal itself all the time. So the question then is, how do you use various things that are available to us, whether these be stem cells or drugs, to actually get the brain to repair itself better, quicker?
My overlying feeling about King's is the expertise, but also it is the follow-up treatment that I received that was fundamental to my rehabilitation. How have you instilled that culture of excellence within King's?
I think one of the most unique things about King's, or our philosophy of care, is that we actually practice what we preach. In a lot of institutions, things that happen in research never really get down to the patient. And one of the key things about King's, or the philosophy at King's, is that as soon as you know something new, as soon as you have experimented with something, you've got new insights either into injury or any other advances in the laboratory, we try and bring it to the bedside as soon as possible. The reason we are able to do that is because the clinical side and the academic side work very closely at King's. That's very unique about our setting. We also are one of the biggest neurosciences centers in the country. We've got about 100 scientists working on various aspects of the brain, whether it be brain injury or brain repair. We have people who have worked into models of injury in the brain, so we understand what's happening to the brain much better. And we can bring that to patients like we did in your case, early recognition of symptoms.
And I wanted to get your opinion about the future and what you see as the future possibility in terms of the treatment of people, so that more people can be treated in the right type of way, in the way that I was.
I think the future is very bright. We now are at a stage where treatment is more immediate, where people get better. It's very rare these days to see a stroke patient who actually does not recover and get better. And that's all because of the progress we've made in understanding mechanisms and changing our understanding into treatments. I think we are at the cusp of actually making very major advances.
So if someone's watching this, what do people need to do if they want to contribute and support this initiative?
Any support would be welcome.
In terms of finance and
in terms of finance, in terms of just support, or in terms of believing in us. But as you may be aware, there's a campaign going on currently at King's to attract funding for all these important and we hope cutting edge developments that provide answers to questions that we've always asked. The campaign's called World Questions, King's Answers.